Thank you for joining us for the Alumni PA panel. We'll do a little bit of housekeeping before we get started. This panel is being recorded and also simulcast on our Facebook page. So for those of you who want to ensure you don't end up on camera, you can keep your cameras off. After each of our panelists talk a little bit about their careers as physician assistants, we will open things up for questions via the chat. We want to welcome our three panelists for this evening: Suzanne Hughes, class of 1991, David Heber, class of 2007, and Colin Rainey, class of 2015. Unfortunately, we were supposed to have one other join us tonight, Erin Gutkin, class of 2016. She ended up being unable to join us. Work-related, of course, no surprise there. So we'll start this evening with Suzanne Hughes. Suzanne received her BS in biology from Washington College in 1991. She went on to earn an MS in biomedical science from Hood College in 1997 and a BS in physician assistant studies from Alderson Broaddus College in 2001. She's currently a neurology and stroke PA at the Sandra and Malcolm Berman Brain and Spine Institute, LifeBridge Health, in Towson, Maryland. She has also worked in neurosurgery, hospital administration, and academia, and participated in mission work. You probably noticed from her background, the big affinity to Washington College. She's currently the chair of the Washington College Alumni Board. Take it away, Suzanne.
Hi, everybody. Thanks for joining us. So good to see you. There's not much more to say other than what Phil just said. I'm just happy to be here and happy to be a resource for everybody. I've had the privilege of talking with so many students since about the end of January. But as I said, I'm here as a resource, and you know, I've been very fortunate to be a physician assistant. I couldn't have picked a better career for myself. Yes, I started off by going into research and getting my master's degree, which was paid for by the company that I worked for, which was a big plus. But I realized research wasn't my gig and needed to go into, you know, actually working with people. And that's why I went for my physician assistant degree. And like I said, I'm so happy that I did. No regrets whatsoever, and happy to answer questions for you folks.
Thank you, Suzanne. We will then move on to David Heber. David received his BS in biology from Washington College in 2007. He went on to complete a combined physician assistant program offered by Anne Arundel Community College and St. Francis University, earning a master's in medical science from the latter school in 2010. He's held the certification for added qualification in emergency medicine since 2015. Currently works as a regional traveler PA for Apollo MD, serving in 8 different emergency departments in the Charlotte, North Carolina region. He previously spent 8 years at MedStar Franklin Square Medical Center in Baltimore. And in 2017, he was recognized as one of 50 PAs making a difference by the National Commission on Certification of Physician Assistants. David, thank you for joining us.
Thanks, Phil. Glad to be here. Yeah, you know, I think the PA profession is one that all of us, if you talk to any PA out there, will say they're very happy with their choice in this career. I really have never met a PA who's regretted it. I don't know if I've met anybody who's kind of left the profession either. So something obviously any of us that you speak with would strongly recommend. I started my career early in medicine at Washington College. I worked for the Queen Anne County Rescue Squad, which is kind of how I got into emergency medicine. And I think most people, once you get into emergency medicine, you kind of don't get out of it. Yeah. So after going to school, naturally, my first job was in emergency medicine at MedStar Franklin Square in Baltimore. Worked there for 8 years, spending the last 4 as the chief PA with a good large staff of PAs. I think we had over 30 full-time PAs on our staff there. We used to be the busiest emergency room in the state of Maryland. So a lot of great learning there at a school, good general medicine. And then when it was time to leave Maryland and move down here to North Carolina, where I took a job as a regional traveler, kind of get a lay of the land, working all the different ERs, and I've thoroughly enjoyed that. Again, kind of expanding my horizons, learning from many different people, getting to work with more attendings, which is always, I think, a positive thing for the education. And so right now I'm enjoying not doing anything in administration and having more free time and just practicing medicine which is, of course, what I love to do the most. I did enjoy the administrative aspect of it for 4 years in Baltimore, but really, my passion is just practicing good medicine.
Thank you, David. Our final panelist is Colin Rainey. Colin received his BS in biology from Washington College in 2015. He then graduated from the Towson University CCBC Physician Assistant Program in 2018, earning his MS in Physician Assistant Studies from Towson. He's currently an orthopedic trauma physician assistant at Sinai Hospital in Baltimore. He's a member of the Sinai Hospital Orthopedic Trauma Team, home to a world-renowned international center for limb lengthening. Thanks for joining us, Colin.
Thank you. Thank you so much, Phil. And it's a pleasure to be here. I'm happy to be back. Not physically back, but happy to be back on a Zoom at Washington College. I finished Washington College in 2015. Took a bit of a gap year. Applied for schools then in 2015. During that time, I guess I'm the most recent, so I guess I can kind of go through all this. During that time, I did some medical assistant stuff, did some scribing in the ER, and then eventually got into Towson, graduated Towson in 2018, and then accepted my first job in neurology right outside of that. Did that for 2 years, loved it. Actually with another Washington College grad named Victoria Trott. I don't know if anyone else knows her here, but this was an outpatient neurology practice in Annapolis. She also went to the Anne Arundel Community College program. After that, the commute became a little too long, so I stayed in Baltimore to do what I really want to do after school, which was orthopedics, and got into trauma orthopedics, which has been amazing. It's extremely fast paced, you have to be ready to change on a dime, and I love it. I'm happy to answer questions. I'm happy to provide my phone number. I'm happy to answer anything in terms of CASPA. Please feel free to reach out.
Colin, I do want to throw in for everyone, since we learned this before we had everyone come in. You shadowed with someone else on this presentation. Is that correct?
I did. So it's funny. I would say, so I shadowed Dave about 5 years ago at Franklin Square. And then the funny thing is that actually my first job was I went to the gym in Severna Park, Maryland, and saw someone in a Washington College sweatshirt. And I said, hey, you went to Washington College, so did I. And she said, oh yeah, I'm a PA. I work in this outpatient neurology practice. And I said, oh, wow, that sounds interesting. And, we exchanged phone numbers. And then from there, I ultimately got a job like that. So you use your resources as less, because it can go a long way.
Absolutely.
So we'll open it up for questions. And I mentioned before the chat, but I also think that we have a manageable group. So if anybody wants to jump in and actually ask a question without typing it, it's perfectly fine.
Absolutely.
Oh, go ahead. You first? All right. So just when applying to PA schools, like how can I make myself like more competitive? Is there like a better way to get hours when applying, or?
Can I at least suggest, Sean, that you definitely read the requirements for all the physician assistant programs that you apply to, because not all of them require hours or have a specific number of hours that they require. And it behooves you to do something similar to what David did with regards to working with Rescue Squad, and as well as what Colin did with medical assistants. I worked at Anne Arundel PA program for 5 years, and reading many applicants, working as a scribe is not as valuable as those two other positions that I've described for you.
Okay, thank you.
Yes, sir.
So I'll give you my take on applying to PA schools, and Colin went through more recently. And, if you worked at Anne Arundel, the community college, and then reviewed applications, you might have a better take on this. But my take on applying is it's honestly kind of a crapshoot. I think I applied to like 11 or 12 PA programs. I got interviewed at 6 and I got into 3. And so when you step back and look and say, you know, how do you get into multiple PA programs and then others you don't even get an interview? My, you know, take on that is the PA programs are looking for diversity. And so they're looking for a couple people with EMS experience, a couple maybe former nurses, respiratory therapists, medical assistants, a scribe or two. You know, they want this diverse class. They don't want all nurses or all former, you know, EMTs, paramedics. And so when you apply to a wide range of programs, it really increases your chances. Because if, say, your background, like mine was an EMT, and you applied to school A and 30 other EMTs applied there, you may not have a good shot. But you apply to school B and only 2 other EMTs applied, you've got a really good shot if they want that diverse mix. And so, you know, getting that good hands-on patient experience is best. And then I think just applying to a lot of schools. But Colin, you went through more recently. Suzanne, you've got experience. I don't know if you guys can answer that better, but that's my take on getting into PA school.
I wouldn't say, I understand David's perspective of it feeling like a crapshoot. When I was at Anne Arundel, so I was at Anne Arundel for 5 years and had just left them in 2017, I believe it was. Anyway, we would get like up to 800 applicants. We would have to dwindle it down to at least 100 to 150 maximum, because we ideally would only interview anywhere from 100 to 110 students for 40 spots. So GPA #1, okay? When Anne Arundel went and joined University of Maryland for the master's portion of it, then we had to take in consideration GREs because of University of Maryland. But when we were looking at individuals, from my perspective, I needed somebody who really could speak well, and say, you know, give me more than just cookie cutter answers, either in their essay or when they spoke to us in the interview, because everybody wants to help folks. That's wonderful. That's a given when you go to apply for a physician assistant program. So you really need to dig deep and speak well for how, like, your life experiences have changed you, what you've learned from them, what you're going to use from that experience moving forward, that sort of thing. And as I said, for your, you know, patient care experience, having more hands-on experience speaks better than being a scribe, because when I would have a student who was only a scribe, they wouldn't know how to use a stethoscope on day one. They would not know how to use a blood pressure cuff on day one. So, you know, to me, that was, they were behind the 8 ball when they were starting off, and that was going to be a bigger challenge to them throughout their entire time going through school, because they were having to look up every phrase or word in a medical dictionary, because they were not exposed, and it was just tougher for them to get through the program, if they were even able to get through the program, having not had that those hands-on experience.
I can speak to, I guess, what I saw at Towson a bit. And Towson judged community service hours largely. If someone came in with a ton of community service hours, you know, everyone has a GPA, everyone has the patient care contact hours, but if someone came in with a ton of community service hours, that was big. And I think in a lot of the professors and at least the dean in Towson's eyes. I think the other thing that is kind of an odd thing, but I think the other thing is applying early, is getting your CASPA in early. I found when I applied, and I think I got my CASPA in like May, I applied to like Arcadia, and they reached out to me almost immediately that they already filled their class, and it was June. They had already filled their class, and so there wasn't even an opportunity for me at that point at that school. So I think getting your CASPA in early, making sure it's clean, making sure it looks good is very important too.
Colin, I definitely agree with that. The earlier, the better, for sure.
Okay, I have a couple questions that came in via chat, but I know Kaylin patiently waited her turn here. So let's go to Kaylin. No, don't shake your head, Kaylin.
Just go for it, Kaylin.
Yeah, I've already talked to you, and I've asked you a lot of these questions, but I get my first one was a little general. Why did you choose the PA profession? But I'm sure I'm going to have more specific ones down the road.
Gentlemen, do you want to take that?
Was it why did you choose the PA profession? Sorry, you broke up a little bit.
Yeah.
Yes.
Sorry.
No, not your fault. I found, and it's funny that again, I was shadowing Dave. I found that when I shadowed, that PAs were more on the front line, and I wanted to be on the front line. And I think this is kind of a cliche sort of answer, but it's also true. Is that we're touching patients, we're making medical diagnoses, we're filling the gaps in healthcare. And I thought, and that was important to me. I didn't want to get bogged down in everything else that came with being a doctor.
Yeah, so I'll answer that a little bit too. I was telling these guys before you came on that when I was in Washington College, general pre-med program was pretty much what it was. And Dr. Ville, the head of the program at the time, kind of challenged me and asked me, why did I not want to go into nursing, or why not into the PA profession? And I honestly hadn't heard of the PA profession, didn't know a thing about it. This was, I think, my junior year. And so I went back and researched all about it, and I came back to her, like the next day, and I said, well, that's exactly what I want to do, is be a PA, because I just hadn't had the exposure. And, for me personally, I was a good student, but it didn't come easy. And, I think being a really good student comes very naturally to some people, and it's harder for others, and they have to put in more work. I was somebody that had to put in more work. But I was on the soccer team. I, wanted to do community service and work for the rescue squad, and couldn't spend all my hours in the library, which I honestly think had I wanted to go to medical school, and that was what would have been required of me. And so looking at it and saying, 4 years in the library at Washington College, 4 years in med school after that, 3 years of residency, and just what did that life look like versus, kind of enjoying my college experience a little more, working at the rescue squad, which I think has made me a better PA, getting that experience, then honestly really buckling down for of course, working hard at Washington College, getting good grades, but then really buckling down for 2 solid years in PA school, and then coming out and having all the knowledge I needed. That's kind of my path and my take.
That actually segues. I'm going to go a little out of order with the ones I'm looking at in chat. There were a couple that came in direct, and I know there's one out there that everyone can see. But one of the questions was, what is your favorite thing about being a PA?
Taking care of my patients. I mean, I get so much joy out of really connecting with them. And at this point in time, I'm working with stroke patients, and I'm working with their families, and it's just it's brought everything to fruition to me, because I started out in neurosurgery, was my first job out of PA school. And then I've gone through hospital administration. I did a lot of patient education for 3 years, and I developed a readmission prevention program. And then I went into academia, and now coming back to neurology, to stroke, it has just brought everything together. And that really, it's it. Working with my patients.
I'd say, obviously, I absolutely love what I do, taking care of patients, talking with them. Obviously, the best part of the job. Like I said, I spent 4 years in administration with less clinical time, and I'm very happy to be back, full-time clinical, because it's truly what I love. As a more broad answer to, I think a huge advantage of the PA profession is being able to move into the different specialties. Certainly talked to a number of physicians who they love what they do. Maybe they're neurology or their surgery, but you get some burnout at times, for sure. I mean, we all do. And the fact that they're always so jealous to know that we can switch from profession to profession, right? Like if I want to go, if I say worked surgery and took call all the time and got burned out from taking call, and now I go work in the ER and I do my shifts. And when I'm done, I'm done. I'm off the clock. I'm off the clock. You know, that's it. And we have that ability to bounce around. And that's something the physicians don't have. And honestly, when you talk to them, they're jealous of it.
Agreed.
Totally agree.
Yeah.
We'll back up a little to a question sort of related to the first question in terms of, and this is the question everyone wants to know right now. How do you recommend obtaining hours right now during COVID?
Yeah, I guess my take would still be following David's example of joining to work with EMT, paramedic, or rescue squad. That's going to be your probably best bet, because people aren't going to let you volunteer. I can't bring students in right now to help, to shadow with me, which really stinks, because I've been wanting to for years, and it's not going to happen. And I can recall listening to a recent radio program how a woman wanted to do her clinicals. This was for a nursing program, but she didn't want to get the vaccine. But to counter the not getting the vaccine, she's like, I'm willing to get COVID tested twice a week. And I wanted to call into this radio program and say, just because you're volunteering to get the COVID test twice a week doesn't mean that whatever program, whatever hospital you're saying that you're going to do this for is going to accept it. The university may say, okay, but every hospital has their regulations, and you can't go against those hospital regulations. Sorry, I went off on a tangent.
No, it's tough. I really don't know. I think we are bringing in our first student this coming week. So it's definitely been an odd time. I don't know. I mean, reaching out to practices and asking, I mean, it can't hurt. Just to say, hey, do you guys need a medical assistant or something like that? I'm trying to go to physician assistant school. Do you need a medical assistant? I mean, it doesn't hurt. I think that's a good, and also a good place to start if you're trying to get hours.
Yeah, I think some schools they want actual shadow hours of PAs, and that's going to be tough right now. But I think getting a job in the medical profession, whether it's medical assistant or EMT or whatnot, I mean, it's an actual job. You're going to work, you're going to get those hours, and that actually probably counts more than anything. So I think getting something, and a lot of these programs, I mean, when I did my EMT, it was at University of Maryland over the summer. It was an intense program. It was 6 weeks or something. And normally it's a semester or a year-long course or something. And they're probably saying with medical assistant, you can find these programs out there that you can do a rapid, quick course and then get in and get working. Because actually having a job in it, that's going to guarantee you the hours.
Here's the final one of the group that I received first. What extracurriculars were you involved in during your undergraduate career? We know a little bit for David, and Colin and Suzanne too, if you want to chime in on that.
I was an RA. I was in the SGA. I was VP of my class. I was doing mock trials. I was helping out with the, I'm trying to think of what they called it. If we had any student disciplinary trials to do, I was doing that. Nothing fun, really. I was a tour guide. That was probably the most fun I ever had, because I did that for 4 years, and that was fun.
I was in a fraternity. I also held a job in the athletic training room, as a student associate trainer. I was in the SGA for a little bit. I think that's probably rounds it out.
And that's actually, Colin, you bring up a really good point. If the athletic department allows student trainers, That's excellent. I would say, I don't know how much room they have for folks. And there's how many of you here? 5, 6, 7, 8, 9, 10. I don't know that you can all volunteer to be athletic trainers, but that is excellent, like hands-on experience for you guys. So again, it's going back to volunteering. I'm thinking, physical therapy groups, again, that can be hands-on, but again, that's more, they're going to be restrictive because of COVID.
So I thought this was a good question that's showing, if you could repeat your undergraduate studies, would you supplement your biology major with any courses in particular to better prepare yourself for PA school?
Sciences are going to be your friend. You gotta know your bio and your chemistry. But my, I guess, suggestion is to definitely also find classes that you have fun with, or that's gonna make you an attractive, well-rounded person. So if you find interest in philosophy or English or history, go for it.
Yeah, I mean, I would agree that the sciences are going to be your best. It's going to give you the best foundation for PA school. But I think looking at the requirements of all the PA schools is important as well. Like I said, I decided I was going to go into PA profession my junior year, and a lot of them required psychology classes that I had not taken. And so my senior year, I took like freshman psychology classes. Because they required it, and so that's what I had to do to be a good applicant. So I think knowing, again, what the schools want, they want a wide variety of classes. Luckily, at a liberal arts school, that's pretty easy to do, but paying attention to those things is important.
Yeah, not only psych, but statistics seems to be a stickler for some folks too.
Yeah, so whatever the class, whatever schools you are looking at, look and see what classes they want, and then make sure you get those in. Or if you're taking a gap year, plan to get them somewhere.
Absolutely, yeah.
Now, I don't think this directly answers the question, and Dr. Winterborn, you actually might be able to attest to this, but I think we still I took comparative anatomy at Washington College, which was a lot of the schools were a little bit weird about that. Because they want human anatomy. But I actually think comparative anatomy really helped going into human anatomy. So I think that's a good thing that Washington College offers. But I mean, if you want to supplement like kind of going over human anatomy on the side, I think that's good.
Yeah, definitely got to read those requirements. And somebody asked about physics. Can't hurt. I'm not a huge fan of physics, but I did it.
Would an additional master's degree in physiology or medical sciences enhance an application for PA school?
I feel like it gave me a heads up, already having my master's in biomedical science. But I mean, I've got 3 degrees, and my master's is, no offense to other folks who do masters, I did a real research master's project. I mean, it took me 2 solid years of not only collecting my data, but fine-tuning my thesis, doing my thesis presentation and defense. And I mean, it was not fun. And what I witnessed for our students at Anne Arundel doing their master's program online was nothing compared to what I went through.
No. It's not. It's not at all.
Yeah, I mean, I think that the reason that the schools like Anne Arundel do the master's impaired is because other universities, like Duke University, for example, I mean, their physician assistant program is a master's level program.
Correct.
And so I think come out with those degrees. And so to make the Anne Arundel program and maybe Towson and others competitive, they want to make sure you get a master's, like other universities.
And honestly, it became a requirement that all PAs have to graduate with a master's. It's not a, an option anymore. It became a requirement. Because, okay, so I'll take this on another tangent. We are in competition with nurse practitioners. And since nurse practitioners went to a doctorate program, that's what kind of forced the physician assistant profession to require a master's.
So here's a question that I think was maybe partially answered, but I think we'll look at it as perhaps outside of the situation we're currently in with COVID. Is there a way to go about getting hours without needing to take a course to get a certification to work?
So I think some practices, I didn't have a medical assistant degree, so I didn't graduate with or I don't think it's a degree, actually, it's a certificate, excuse me.
Certificate, right?
Yeah, I didn't graduate with a medical assistant certificate. They trained me on the job. So I think there's some practices still out there that are willing to train you on the job. I know for EMT, you definitely have to have the certificate, but there are definitely some practices out there that are willing to train you on the job.
And here's a question that came in. Does your GPA completely make or break your chances of getting into PA school? Is it normal not to get in the first time and use that extra year to focus on diversifying your resume and working to get more hours?
Again, my experience at Anne Arundel, the competition was so fierce. If you didn't make a certain GPA, you weren't even considered to make it into like our top 150 to then, you know, taking consideration of dropping it down to the top 100 that we interviewed.
So
yeah, I mean, I think it's probably the minimum bar that, you know, you have to meet. And then on top of that, you know, like I was saying, I think, you know, diversity and what your experiences are and all the extracurriculars and all those other things then come into play. But to an extent, I mean, you still just have to be a good student to get into the PA program. And so I think that's kind of probably the minimum bar. And now, unfortunately, for you guys, I think that bar is raising every year. I mean, PA schools are becoming more and more competitive. The number of applicants per seats outnumber some medical schools. The good news is I think the pass rate for people that get into PA school is way higher than that of medical school. And so, you know, once you get in, if you work hard, do everything, you know, hopefully you graduate, where unfortunately not the same always for medical school. But yeah, the GPA, I mean, it's very important. It's kind of, like I said, first bar to get over.
I know for medical school, we typically advise if someone is concerned that the GPA is their weakness on their application, that, you know, there's an extra element here with PA school where you often need a certain number of hours of experience-wise, but would your thought process be, and we had another question about those additional master's programs, that a student who's maybe concerned about their GPA to pursue master's or post-bac and try to improve that academic performance?
Absolutely.
Yeah. Yeah, I mean, unfortunately, if your GPA, you know, and look, if you know, bad freshman or sophomore year, you can certainly turn things around, but it may not be enough in time to get the GPA up. But then going on and doing a master's program and doing really well in that, certainly that's going to go a long way to improving your chance. I think the last question was also about, you know, is it normal not to get in the first year? I can't answer that personally, but I would say I wouldn't get discouraged if by any means, if you didn't get it here, you should definitely try and take some extra classes or bolster, you know, show that initiative. You're trying to learn more. You're trying to get more hours. You're trying to be more diverse. Do the community service. I mean, do everything you can to bolster that application. But by no means, you know, does everybody get on their first try, and plenty of people get in on their second or third try, I'm sure. And so definitely don't give up.
Yeah, I will say we definitely, when we had applicants, we definitely took a look at them. We did not, you know, say, oh, we already looked at these folks once, we're not going to consider them. We looked to see, as David said, you know, they went and busted their ass to make themselves even better to apply a second time. So definitely try. But I will also tell you that there are some folks who just relied on like their undergraduate sorry, I'm blanking on the word that I want. Looking at the grades from their undergrad, and I can recall at least one applicant that went and transferred to multiple schools and kept like doing poorly in like a chemistry or some other science. Usually it was chemistry, like organic chemistry, that really screwed people up as far as their GPA, or they kept doing poorly, and that just did not shine well for them if they thought they could, you know, get in on the first try and not like show a concerted effort to make themselves look better.
Here's a question. Is it possible to meet admission requirements directly following undergraduate studies, or is it usually necessary to spend an extra year on coursework or hours?
Depends on what the requirements are. If you've got all the requirements met.
I think
Yeah, I mean,
you're gonna be taking... Oh, go ahead, Dave.
No, I mean, if you have a good GPA and you've got all the requirements met and everything, yeah, I mean, go ahead and apply. And potentially it's only going to get harder year after year. But I think if you're questioning, you know, some of the things, oh, is my GPA, you know, it's maybe borderline, my hours are questionable, then maybe taking that extra year. But no, if you're a strong candidate, go for it.
Mm-hmm.
And there's a gap here kind of built in anyway, almost. It's almost impossible to apply your junior year of college, in my opinion. I mean, there's probably some people out there that do. But I applied my senior year of college for the next year. So there's a gap here kind of built in.
Good question. So this would be mainly for Colin, just because I feel like are probably the most like aligned with our tracks, sort of. I'm also interested in health. And I know it might not have been, probably is the same. Do they have, like, when you applied, did they have the 800 hours required to get in?
It was the patient contact hours.
Yeah.
Yeah, so 800 hours. But to be totally honest with you, many of the students also reviewed applications. Most of the people were coming in with like 2,000.
Oh, okay.
So I would aim high.
Mm-hmm.
Right. So how did you kind of obtain those during your college years? Because if you only took one gap year, then.
So I got really lucky. So the job that I had as a medical assistant, I actually started after my senior year of high school. I got lucky and got into this practice, and then they would let me come back and work over the summer or pick up a shift here and there during school. So again, I got really lucky, and then I kind of going into my interview told Towson that I was, I'm still doing this medical assistant job. This is kind of where I progressed. These are the things I'm now doing since I started. So having those things and going into an interview, you can prove yourself that way.
Colin, how many different programs did you apply to?
I applied to 3. I applied to Arcadia, Towson, and Anne Arundel. And the strange thing was that Anne Arundel got back to me, I guess, well, Towson already got back to me so soon that I didn't even take the chance to even accept or not accept. I kind of withdrew. I guess I withdrew my application from Anne Arundel because you had to put down that down payment almost immediately or you lose your seat.
Yeah, I just want to reiterate, I think applying to multiple schools, though, is kind of your best bet. Not trying to put all your eggs, this is where I want to go, because it's a risk.
No, agreed wholeheartedly. I think I applied to 4 when I did it. And I got a scholarship for where I went, so.
Yeah, I would also just plug, again, we're in the Maryland area. I went to Anne Arundel, Colin went to Towson. There may be considered some smaller schools when you look nationally at some of the PA programs. Again, I'm in North Carolina now, so some big name schools and stuff. But just so you guys know, I mean, the education I think that I got at a community college was top notch. I mean, I did a rotation, down in Atlanta from people who went to school at Emory that were from Colorado, and we would sit and go question for question, and I could answer everything they could, knew everything they did. We do rounds with medical students, and the PAs were all answering questions that the medical students didn't know. So just, I guess, don't worry about the reputation of the name of the school, that you need a big name or anything. I'd say most all people get their first job off of a rotation they did, or through another connection or something like that. I don't think a lot of people blanket resume out looking for jobs. And then where they say, oh, you went to this community college, like we're not going to, hire you or something.
No, but just make sure that it is an accredited program.
Oh, yeah.
Because the PA programs go through a lot of scrutiny over the years. And I don't know if you all had ever heard of the University of Maryland Eastern Shore having a PA program, but that school lost its accreditation, I want to say back in like 2014 or 15. And then, therefore, Anne Arundel and Towson went and inherited the students from University of Maryland Eastern Shore. So it was not an easy transition for those students. And I just can't emphasize enough making sure that whatever program you apply to, find out when it got its accreditation, how recent was it, and how long do they have that accreditation for. To make sure that you don't run the risk of them losing accreditation while you're in school.
Yeah, so then schools can go on like probation too, right? And you should be able to see that. And so I'd be cautious. I would be a little leery if a school's been on probation, especially anytime in the recent past. That would be a little.
Yeah. And honestly, the biggest thing for Towson and Anne Arundel is we're in competition with each other as far as rotation sites. And then you factor in all of the medical students and nurse practitioner students that are also in competition with the rotation sites. So that is when you get to the point of, asking questions to the physician assistant programs, making sure that they are having their butts covered as far as having enough rotation sites for you, because this was something that I almost had to encounter when I went, that I would have to find my own rotation sites. And believe me, you don't want to have that headache of you trying to find a rotation site. Do you see how much fun you're not having trying to acquire your hands-on medical hours for just applying? So I just want to put that caveat out there to you guys too.
We've any other questions out there? I don't see any new ones sitting in the chat, but if anyone wants to take the time to pop one in or just speak up, feel free.
I got lots of questions, don't worry. So could you each just describe your day-to-day life as a PA, like what you do normally?
So I see patients that have just had strokes and recently been discharged from the hospital. So at every one of my post-stroke visits are at least an hour that I'm talking to the patient, gathering not just their history, but I'm also talking with the family. I'm learning about the logistics of their living conditions, or if they're still at like a rehab facility. And then I do my examination, and then I'm trying to, plan their care for the next, at least foreseeable future, for at least 3 months, because that's the next time we as the stroke team are going to see them again. So that's essentially what happens as far as a patient visit or a clinic visit, and then I'm spending a lot of my time doing medication refills, answering messages, filling out paperwork for our patients, whether it be FMLA or insurance papers, or trying to get prior authorizations for medications or imaging studies, or filling out paperwork if they want to try to drive again. It's, the actual time that I spend with the patients might be, I don't know, 5 hours out of my day. The rest of the time really is a lot of administrative phone calls, paperwork, that sort of thing.
Day to day, I mean, my job changes a ton. So I can be in the OR doing surgery. I could be outpatient, managing patients, doing injections and joints and things like that. Or I could be on call, which right now I'm tending to take a lot of night call. So we see a lot of trauma in the emergency department. We're a level 2 trauma center. So the difference between like us and shock trauma, I believe, and I could be totally wrong, is that we just don't have a cardiac surgeon on call. Typically like a level 1 has a cardiac surgeon on call. So we don't have that, but anything else. So, I mean, I treat dislocations, I treat fractures, gunshot wounds. I mean, really anything. So it's definitely fast paced and changes, and you're doing something different every day.
Another couple questions just came in. So the first one, not sure if this was answered, but how did you get into the specialty you are in, whether you started there or stayed, or if you started in one specialty and moved to another?
It happened by luck that I started out with neurosurgery, and that's what I did for at least 3 years. And somehow neurology in general just became my niche, and so that's how I got back to stroke.
Yeah, I started my career in emergency medicine and have been there the whole 10 years. Again, started as an EMT, and I think when you start kind of in that emergency quick mindset, things are always moving, going fast, patient. It's easy to stay.
Orthopedics was always my interest. I mean, I started in neurology, but got an opportunity in orthopedics, and I kind of jumped on it right away.
That probably mostly covers the next question, which is it necessary to specialize in a particular medical specialty, or is that something that you narrow in on during rotations?
No, you want to be a sponge. You want to absorb as much as you can. And as I think we've all talked about how easy it is for us to jump from one discipline to the next, you want to be, open-minded. And the other thing that you'll find out when you go through school and your rotations is that when you go and take your certification exam, your national exam, it's testing all of your general knowledge. So you want to keep up with all of that general knowledge. Just because I'm taking care of stroke, I still have to worry about my patients' cardiac issues, their blood pressure, their diabetes, their thyroid issues. So it's all still one whole person. And don't think that just because we're currently, quote unquote specialized, you're still taking care of a human being. And it's a privilege. It's not something that I have a right to do. It is an absolute privilege to be able to take care of my patients.
Yeah, I mean, I think that you should have an open mind going into the PA program, because you never know on the rotations. I mean, you do all these rotations for a reason, so you can be a well-balanced clinician and go into any field. But you should have an open mind. I think even though I knew I really liked emergency medicine, I mean, I really liked surgery as well, and really considered a career in that. And it was not until I was in that rotation doing it that I realized that. And so you never know what you may get into. And so having an open mind is good. I do think, you know, starting out a little general early on in your career, if you can, is probably a good thing. You know, orthopedic surgery is great, but I don't know, you know, I guess you could get hooked up with a guy who just does like ankle surgeries, and if for the first 5 years of your career, all you did was ankle surgery, you know, in the OR or in the office, and then you wanted to go do something else, it would be very difficult, I think. If you get a couple years of general medicine knowledge under your belt, then you can specialize and then easily go back.
Very well said, Dave.
Mm-hmm.
Real quickly, just kind of running back to the like application process. Do you guys have any like tips or insight to the interview process? Like maybe what kind of questions they ask you guys, or generally like what they're asking or looking for?
Yeah, as I said earlier, don't give them cookie cutter answers, and be able to speak broadly about, like, a lot of times we would ask a person to either not just talk about themselves, but talk about a life-changing experience. What did that mean to you? What did you get out of it? How are you going to use that information to better you or better someone moving forward? So being able to expand and you know, when we were doing the interviews at Anne Arundel, it was like speed dating. We literally were going through 100 people in one day. And so we basically had maybe 15 minutes at most with one candidate to ask them like maybe 3 questions. And so that was your time to shine, and for us to really, you know, for you to say, hey, this is me, remember me, I'm Eric Fly, don't forget about me.
Yeah, I remember during my interview, it was a lot of experience questions. So I think having, just like Suzanne said, I think having like good experiences like in the back of your mind and kind of ready to go is definitely the way to go and prepare for an interview like that.
Yeah, I think I remember a lot of questions because, again, my EMT background is like, what was your most rewarding calls? What were your worst calls? You know, things about your experience that they want to know about. But I think also just having a good, being a good, well-rounded person with, you know, community service and different types of things, and make sure, you know, curricular stuff, and being able to speak to all of those things, and then just being a good, genuine person is important.
And look them in the eye.
All right, thank you guys so much. And David, I know earlier you had mentioned that like sometimes you'll get offered a job like in part of the rotations that you're doing. Is that like generally through your guys' experience, or maybe some people that you've worked with? Is that like generally speaking how, like, I guess your first job comes about, like through the rotations that you go through, or is it something that you have to like search out?
Yeah, I mean, I can speak on it both. You know, that was my experience. I got my first job off of, you know, when I did a rotation at Franklin Square ER. I also then, again, spent 4 years as a chief PA there, and so hired dozens of people. And I would much prefer to hire a student that worked with me for 5 to 8 weeks or however long the rotation was, because I got to know them as a person, what their skills really were. Way more than coming in and sitting across the desk from them and talking to them for, you know, an hour. So I think you can really shine during a rotation and get job, you know, offers that way. I mean, I think I probably got multiple, you know, during my PA program. But again, as somebody hiring, I absolutely want to see, you know, what you can do. What type of person are you? Do you show up on time? Do you come in, you know, dressed well? All those things. And when I spend five weeks with you, I can absolutely, you know, I know that.
It is a great opportunity, but the other thing is, you know, if you didn't want to go into ER, but Eric or David's got friends, PA friends in other professions, and he can absolutely give you a good recommendation, number one, or knowing, say, for instance, you wanted to get into orthopedic surgery and, hey, Colin, I got a good candidate for your team. You know, I'm going to send them your way. So definitely you utilize those rotations not only to learn, but to really shine and to network and to, you know, basically you're becoming part of the PA family, PA friends, and we do know one another and we do talk. And you know, bad things can fly too. I mean, I had students that would go into a surgeon and say, I hate surgery, I just want to go into pediatrics. And so that student was actually kicked off his rotation site because he made that comment. So don't just, you know, say good things, don't say things like that.
I would
more often.
Yeah, I would just add real quick that that's absolutely true, right? If Colin, you know, somebody who wanted to come work with you and you saw they did a rotation with me in the ER, you know, you email me and call me up and say, hey, how was this person? Well, they had no interest in the ER, and so they showed up late. They did subpar work. I'm going to tell him that, and again, we're a small community, and he's going to say, oh, maybe this person's not as great as they seem on their resume and whatnot. So. I think it can be very beneficial, but it can also hurt you if you slack off at all during rotation.
It'll definitely hurt you. I mean, I feel like when I have students that are more engaged, I'm more engaged with them. I will allow them to do more. They can do more at my rotation. So I think just being engaged is huge. And then the biggest pet peeve I have, and you know, this is a little bit farther along, I guess, is just don't ask to go home. I mean, the students that ask me to go home, I'm like, I mean, you're gonna, you know, you're eventually gonna go home, and typically I let kids off early. I'll let them off early, but just stay and act engaged, and it'll all come together.
Well, since no one wants to ask to go home,
That's fine. Yeah, we can ask now. Yeah.
I'm going to be the one who mentions that we're up at an hour, so we can probably take one more question, but while we're doing that, if the three of you, whatever contact information, if you feel comfortable sharing in the chat, please feel free. And then, you know, I'm sure there's still some other questions out there that if people want to answer or people want to send you, that they can reach out and do it that way. But I'm sure if you're comfortable sharing an email or anything like that, to go ahead and put that in. And otherwise, if there's anyone out there with one final question, we'll take it.
I'll ask. I guess what's the one thing that you wish you would have known before either applying to PA school, going to PA school, or practicing as a PA?
I'm sorry, Caitlin, you broke up. Can you ask again, please?
Yeah, sorry. So what is like one piece of advice or something that you wish you would have known before you applied to PA school, or before you went to PA school, or before you practiced as a PA?
I actually wrote this down to say beforehand, but I think one thing that I wish I would have done as a student, a PA student, is actually make more mistakes. I think in your rotation, it's important to like I was saying, engage and try things and ask your preceptors things and continue to stay engaged. And in that, you're probably going to make more mistakes. And I think that's important because that's your time to learn. And I wish I would have not been as quiet, maybe per se, and made more mistakes and put myself out there a little bit more.
Yeah, I think in PA school and on rotations, people are always afraid to embarrass themselves and give a wrong answer and look foolish, especially when you're on rounds with, like, you know, you can be up with like 10 or 12 people, you know, following around the attending, and you got PA students and medical students and residents and all this stuff. But it's where you learn. I ask my students when I have them a lot of questions. You know, it's considered, you know, pimping, and it's an old school thing, and it's considered mean. But I always tell them at the beginning, like, I'm gonna ask you these things, and I could care less if you get them right or wrong. But if I don't know what you don't know, I can't teach you things. And so if you always just pretend like, oh yeah, I know what you're talking about, so I don't look dumb, then you're gonna miss out on the education. Because when you say, yeah, you know, I don't remember what that was from PA school. Great, let's talk about it. Let's educate you, and now you're going to be a better clinician. And I think that's most PA's goals. I think it's old school of the, you know, I'm here to humiliate you or anything like that. So just asking questions and being willing to be wrong is probably the best thing you can do. As far as before PA school or before my job, and I think just knowing, having talked to a lot of PAs, that it's, everybody loves their career and it's when they're happy with the choice they made. I think that's, you know, the most reassurance I ever needed.
And I would just encourage, I mean, always ask questions. You don't know until you ask the question. And this just not only follows through for what Dave was just saying, but I mean, when you're going for that job interview, do not hesitate, because the one thing I will always remember when I took the job at PG Hospital, and I knew I was going into doing 24-hour shifts, but I didn't really realize what I was getting myself into. And when I applied for it, I thought I was going for trauma and neurosurgery. And that was not the case whatsoever, because not only did I have to help the trauma team and cover for neurosurgery, I also had to cover for urology, plastics, ear, nose, and throat, vascular, and I think there was something else, and I never realized. And so I lived a year of hell doing 24-hour shifts, but I chalk it up to my year of I did my own surgical residency because I covered all this stuff for a year. That was my experience.
I would also quick give the recommendation of volunteering to be the person to do something. So in school, whenever they, you know, oh, we're going to practice this or try this, like I would volunteer to be the patient, because you get to experience what that clinician is teaching hands-on to yourself, way better, you know, learning opportunity than just sitting there watching it. Same on your rotations. If there's hey, if anybody wants to, you know, volunteer to go to this surgery or do this, like always volunteer. It may be a little more work, but you're going to gain a ton of knowledge that you'll use later in your career.
Okay, well, I want to thank all three of you for joining us, taking the time this evening, and being willing to share your insights with our current students. And again, oh, here's some thank yous coming in. Again, thanks once again, and thanks everyone for hopping on tonight and asking lots of great questions. I think we probably could have gone another hour if we just left everybody to it. But again, you got Suzanne and Colin put their emails in. I know David's on sort of a different version of Zoom, I think. So, David, if you're comfortable with it, if you want to have me type it in, or I can send it along to everyone later, that's fine too.
Yeah. Feel free to share. I'm happy to talk with anybody, answer any questions. Yeah, you can type it in for me or send it however is best. But yeah, I encourage anybody to reach out with any questions they have.
Yep, absolutely.
Absolutely, please feel.
All right. Well, we'll do the usual awkward Zoom goodbye. We'll all wave and say good evening. And I see a couple people jotting the emails down. So hope everyone has a great night. Thanks, guys.
Very welcome. You guys take care. Bye now.
Have a good one.
Thanks, Phil. Bye.